Hi for a stretch. We've got some hard work ahead of us here. You ready? So I want to talk a little bit about research. The presentation has 4 sections. I want to do, in a few quick minutes, some basics about research in spiritual care. Some of this is material some of you have heard before, but always, I think, worth reviewing quickly. I want to introduce you to some resources about chaplaincy research. I want to do a very quick illustration of 3 or 4 different kinds of important chaplaincy research that are being published right now. And then I want to talk about the challenges for the profession about advancing chaplaincy research. So that's where we're headed. So just to kind of begin with the basics, you're aware in some sense that over the last 20, 25 years, we've actually kind of moved into a new paradigm for chaplaincy practice. And that paradigm is a paradigm about kind of a research-informed approach to practice, or an evidence-based approach to practice. And many chaplains sometimes wonder, why is it that we have to kind of get involved in this research? Are we trying to kind of, look like we're scientists instead of being the chaplains that we are? And I think whenever you kind of wonder about the motive for why we're getting into chaplaincy research, it's important to kind of remember the question that's at the top of this slide. And that is, how is it that you know that the spiritual care you provided this week is the best possible spiritual care that can be provided for patients and families under your care? So the kind of main motive for chaplaincy research is actually to be sure we're providing the best quality care we possibly can. Over the decades, we have answered that question through a variety of different methods, and you'll see them listed here. It's tradition, we've always done this way. It's a policy. I had wise teachers. They taught me to do it this way. I trusted them. Trial and error. I tried it one way. Boy, that was a disaster. I tried it another way with this kind of patient and family. Seemed to work a lot better. I'm going to stick with that. So all of those have been ways that we have known what good spiritual care is about. And what I want to propose to you is that research becomes another way that we know what good spiritual care is. It's not the only way. It doesn't replace the other ways, but it's a very powerful way for us to know, and it's a very powerful way, as you've heard all day long, for us to communicate to our healthcare colleagues about the value of what we do. So if you get tired about this research thing and you wonder, why is it we have to kind of bother with all this research thing, I think I want to kind of recommend to you that the answer is that research is one important way that we can each know that the care we're providing is the best possible care possible. So as Jana reminded you, we have standards of practice, and from the very beginning, our standards of practice have said that we will use evidence-based approach to spiritual care. And one of the things I'm not going to go over the definition about evidence-based spiritual care. What I mean evidence-based practice means here, some of you have heard this before, and we're a little short on time, but we can come back to it in the Q&A if some people want to talk about it. But the important thing to remember about the standard is that the standard doesn't require that every chaplain be a researcher. Can I say it again slowly? The standard does not require that every chaplain be a researcher. The standard requires that we all be research literate. That we need to be able to read and understand and critically read and understand simple research articles and be able to discuss their application to our professional practice. It's important to emphasize critically read. Chaplains seem to be pretty good, actually, about being critical readers of research. But it is important to remember that not all research that gets published is really equally good. So we do need to learn how to be critical readers. That's why we need to be research literate. And we need to remember that the standard is actually talking about being critical readers of basic and simple research. There's very advanced and complicated research getting published all the time. Some of it's relevant for our profession. Some of it's way beyond my understanding. And so I frequently have to kind of ask people for consultation and help to understand complex studies. Chaplains shouldn't be hesitant about that. Researchers love to explain what they do. They're kind of lonely people, actually. And if you go up to them and say, can you explain what this research means? They'll feel included and helpful, and they'll enjoy that. No, but quite seriously, actually, don't hesitate to ask people to explain complex research. It's actually often, we're all encountering research whose methodologies or whose interpretations or details are actually complex, and we need help understanding that. So we've done part one. Okay, good, right? What are the research basics? Why are we doing this? What is it that our standards are asking of us? Part two, what are the resources that are available for chaplaincy research? If I want to kind of catch up with the existing research, if I want to know what the existing research is so it can inform my practice, if I'm thinking about doing a little bit of research, maybe I need to know what exists already so I don't unnecessarily duplicate what's out there. So what are the resources that are available to us now as a profession to help us with chaplaincy research? A very important kind of resource is a review article. The first major review article was actually 2008, and it's represented by this circle with the boxes. It was done in the UK, actually by Harriet Moat, who's a UK researcher. And on the slide, you'll see the URL. Actually, it's available as a free download. So it's about 10 years old now, so it's a little bit old, but it's an excellent starting place if you're thinking about kind of developing research literacy, or you want to kind of bring together a group of colleagues who want to kind of learn to what the chaplaincy research is about. It's a great beginning place. Across the top, you'll see the article that David mentioned that I published a few months ago in the journal Pastoral Care and Counseling. It's designed to be a kind of one-stop shop for overview of chaplaincy research in the last 15 years. And then across the bottom actually is the URL for a really comprehensive and recent review of chaplaincy research done by our colleagues in Melbourne, Australia, actually at Spiritual Health Victoria. So there are a number of different reviews out there, and those are great places to start. Many of you know about the Transforming Chaplaincy Project. It's a project that Wendy Cadge and I co-direct. The major funding came from the John Templeton Foundation with support from all of the strategic partners in the United States. It's a $4.5 million four-year project. We're halfway through it. If it had not been for the support of the chaplaincy organizations, the Templeton Foundation would not have bought into this idea. But they saw that the strategic partners really were committed to advancing chaplaincy research literacy and gave us the resources to help do that. So it has a number of components. We've sent a bunch of chaplains off to get research degrees. We're giving CPE centers in the United States money to kind of teach research literacy. We have the online, 8-week online introduction to research courses that are available to any member of any of the strategic partners in the United States. First one is going right now. The second one will be offered this spring. There's kind of a waiting list for the second one, so it's going to be hard to get on that, but the two that we'll do next year, next fall, next spring, there should be seats open for them. You'll see at the bottom the URL for Transforming Chaplaincy, www.transformchaplaincy.org. So that's the place to kind of contact Catherine Lyons, who's our project coordinator, if you want to get on the waiting lists for the online course or get any other information about the Transforming Chaplaincy project. But there's two other things that I want to bring your attention to. This past summer, we had a research summer camp. We actually called it the Chaplaincy Research Summer Institute. It was a week-long opportunity for chaplains to come together to kind of get a robust kind of introduction to research, to network with one another, to get consultation from small groups and from chaplaincy leaders, research leaders about ideas for chaplaincy research. So we did the first one this past summer. We had originally planned to kind of have space for 20 people. A lot of people kept knocking at the door, so we actually increased the enrollment to 30, and I think it was very successful. So we're going to do it again next summer. The dates will be July 23rd to 27th. We'll do it in Boston. Our host will be Boston University School of Theology. And if you'd like to apply for one of the 30 seats, you should send Catherine Lyons an email right now to let her know that you'll be interested. We'll begin reviewing those applications and making those decisions hopefully before Thanksgiving is over. For 2017, all of the Chaplaincy strategic partners offered scholarships for members of their organizations who needed support to attend, and hopefully that will be true again in 2018. So summer research camp, we have a great time. We go swimming, we go hiking, we do some other craft activities, and then we learn about research together. So come and join us for Chaplaincy Research Summer Camp. It'll be really great. The other new resource that's coming out is probably before the end of this month, we will launch the Chaplaincy Research website. This is a project that grew out of the Joint Research Council. So many of you know that the Joint Research Council is a group of chaplaincy organizations actually from around the world, from Australia through North America, through Europe, all the way over to Israel, who have an interest in supporting chaplaincy research. And who come together with the support of APC to kind of dialogue about the ways in which we can work together to advance chaplaincy research. So with support from APC and the Transforming Chaplaincy Project, we're starting the Chaplaincy Research website. So it will be announced in the newsletters of all the different chaplaincy organizations, but we will also be creating our own monthly newsletter. So again, if you're not already on the Transforming Chaplaincy email list, if you will go to Transforming Chaplaincy and look for the email, sign up there when the website is launched. We'll send you the first newsletter, because it will have a monthly newsletter. It'll have a Facebook page. It'll have a Twitter page. It'll have weekly and monthly updates about chaplaincy research. It'll have information about chaplaincy research education. It will have information about conferences and grants, and we hope it will be kind of the major go-to resource. Appreciate everybody's support, and we will look forward to your suggestions about how to make it more effective to serve your needs. So those are some of the things that Transforming Chaplaincy is doing. Many of you will already know about the APC Webinar Journal Club that my colleague Pat Murphy and I do 5 times a year, and you're welcome to go to the APC website to sign up for the sessions this year. And sessions from previous years are also available. Earlier today, I think Trace Haythorne mentioned John Eamon's wonderful ACP Research Network website, which John has maintained for 15 years now, and one of the outstanding features is the Article of the Month, in which John picks an excellent article that chaplains should know about and provides a very thorough introduction and review. And now there's 150 of those reviews on that website. They're searchable. They're incredible resources. And although it's the ACPE Research Network website, it's actually available to everyone. So the URL is here on the slide. Very interesting, easy to get to, and an outstanding resource for us all. I think the last resource I want to mention actually comes from healthcare chaplaincy. When healthcare chaplaincy had the grants from the Templeton Foundation that supported the 6 chaplaincy palliative care research projects, one of the things that was produced during that time was this kind of introduction to chaplaincy research. So it's about 200 pages. It has wonderful sections about what does it mean to shape a research question, what does it mean to kind of think about appropriate qualitative methods, quantitative methods, study design, kind of a nice introductory chapter about statistics and several other chapters. It's a free download from the Healthcare Chaplaincy website. And so if you or some colleagues want to go beyond research literacy, you want to begin to think about doing quality improvement project or a research project, it's a great resource. So here's the sampler. Oh, I think I have 4 studies under the sampler. Probably have time to do 2, right? So can't not tell you, right? So an important body of research is about what chaplains do. We've talked a little bit today at different times that many of our colleagues actually don't know who we are and what we do. And so we have thought that actually having robust case studies is an important way to educate colleagues. So there have been some case studies in the Journal of Healthcare Chaplaincy, and 2 years ago my colleague Steve Nolan, and that's Steve's wonderful picture, published this book of chaplaincy case studies, 9 case studies from around the world. Steve and I are working currently on volume 2 that should be available this coming summer. And just to kind of shout out that Steve will be one of the keynote speakers for the upcoming July APC and ACC plenary conference. And really, it's going to be an outstanding conference in many ways, but Steve in and of himself is actually someone to come to hear and interact with. And so case studies are an important part of the research that we do. We can talk more about that in the Q&A. Another thing that we need to do, which we've referred to today, is actually screen for who needs spiritual care. How do we identify patients who are experiencing spiritual distress, particularly as chaplains move into outpatient care and home care of all the hundreds of patients who are being seen in those contexts? Which are the patients that our healthcare colleagues need to be sure to refer us to? So there continues to be a lot of research about best practices in spiritual screening. And this is a paper that Stephen King and Pat Murphy and I and other colleagues worked on, in which the two combination of this first question, loss of meaning and joy in your life, if somebody said yes, and or if they said have what struggle. So, with chaplaincy care now come actually in New York that demonstrated, compared to chaplains, patients who had no chaplain visit, patients who had a chaplain visit in the electronic medical record had higher scores on 6 different items measuring patient family satisfaction. What we haven't mentioned up to now today is actually higher satisfaction scores, maintaining high satisfaction scores, is actually associated with Medicare reimbursement. So our administrative colleagues are actually very aware of the importance of patient-family satisfaction, and evidence that actually chaplains contribute to patient-family satisfaction can be an important kind of evidence about the importance contribution we make to family care. The last bit of evidence about outcomes is the study from Joel Burning and his colleagues at New York Presbyterian, in which Joel was working with patients in the ICU who were alert, conscious, but actually mechanically ventilated, so they couldn't communicate, and they were experiencing a lot of anxiety, and it was hard to communicate. And so Joel was trying to figure out how can we be helpful to those patients, and he came up with these wonderful kind of picture cards that allowed people to identify their religious and spiritual affiliation, and to identify the level of emotion that they were experiencing, and to identify their preferences around spiritual care. And then they actually tested whether or not the chaplain's visits using the picture cards had an impact on anxiety. Before Joel went in to talk to the patient, a physician went in to say to the patient on a scale of 0 to 100, how anxious are you feeling? And at the beginning it was about 66, the red dot on the left. And then after Joel had visited the patient, the physician went back in and said, could you tell me how anxious you're feeling right now on a scale of 0 to 100? And by then it was now down to 44. So on average, there was actually a 20-point decrease in anxiety when patients were visited by the chaplain with the picture card. So a really wonderful example of some important intervention by chaplain, and some initial research testing it. So we've done 3 things. Jerry, I got 3 more minutes, right? I can get through this last section in 3 minutes. We're golden, huh? All right. So the issue is we're learning what it's going to take to advance chaplain research literacy and to advance a research-informed approach to the profession. So we need to kind of continue to embrace an evidence-based approach to our profession. We need to encourage all chaplains to be research literate, for chaplaincy training programs to include research literacy, for chaplaincy departments to kind of tune into the webinars, to have their journal clubs, and to begin the kind of important work of developing research literacy. We're advancing our evidence-based approach. So we're beginning, I'm going to have to read this. It was chaplain researchers develop research to advance evidence-based practice. So what do we need to do this? We actually need a group of chaplains who have research training, right? So that's part of what the Transforming Chaplaincy Grant is doing. It's allowing us to send 16 chaplains to get master's degrees in research. So that's a start. Those chaplains actually need employment when they finish their master's degrees, and they need employment not just as chaplains, they need employment as chaplain researchers. They're not going to help the profession if we make them on-call chaplains over the weekends. You know, that's just not what they're trained to do. We need to actually have jobs for them as chaplaincy researchers. So when we originally created the fellowships and people applied in the first cohort of fellowships, one of the people who applied said, will there be a job for me as a chaplain researcher when I finish this fellowship? And so we actually realized, well, we're not quite sure about that answer. So we put an FAQ up on the website and said, we're all going to work together to transform the profession. So there'll be jobs for chaplaincy researchers. So we need everybody to help with that. We need networks of chaplaincy researchers who share research interests in common clinical conditions. Pediatric chaplaincy research, mental health chaplaincy researchers, palliative care chaplaincy research, people who are actually interested in senior care, aged care, who want to work together to develop an evidence-based approach to spiritual care and aged care. Research doesn't happen from a lonely researcher kind of working in his or her office. It's actually a team activity, and chaplaincy research will really not advance unless we actually develop partnerships with experienced researchers who have track record of grants and research in particular clinical areas. So those partnerships are essential. And then we also need pilot grants actually to help chaplains and their partners do some initial research so that they can move forward. So who's going to do all those things? George and Wendy? George and Wendy have been doing good for 2 years. Why don't you guys keep doing that? It's not enough. And the Templeton grant will be over in 2 years. And Templeton is not likely to renew that grant. That's not their pattern. So all of the momentum and initiative that we have achieved over the last 10 years, last 15 years, over the last 2 years, we actually need to think about how we're going to carry that forward and who will do it. And that is a very serious challenge for the whole profession, all of the strategic partners and their leadership, and the membership of all of the organizations. We heard over and over and over today about how important research is to the future of the profession. But it won't happen unless all of these people begin to get involved. So that means all of us as individual chaplains committing ourselves to be research literate and to be informed consumers. We need spiritual care departments to step up to actually begin to kind of, help research literacy get embedded in the members of the departments. We need spiritual care departments, particularly in academic medical centers and in large faith-based healthcare systems, to commit to employing chaplaincy researchers and giving them the resources to do chaplaincy research. Without a new level of commitment from large spiritual care departments and large academic medical centers, and a very new level of commitment from our faith-based healthcare systems, who have not been leaders in chaplaincy research yet, but we're ready for them to pick it up and carry it forward. Without a new level of commitment from both of those kinds of organizations, we're not going to advance research in the profession the way we need to. So that's an important challenge we have to embrace. Similarly, the strategic partners need to kind of move beyond putting research in their strategic plans and putting research dollars in their annual budgets. It's a very essential step that has to happen. And those research dollars are important to support the website. They're important to kind of bring speakers and things like that to our meetings. But the organizations also need to embrace actually the mission of providing pilot grant money for chaplaincy researchers. That's very hard to get an initial study going, very hard to find initial money for that. And the seed grant money from the professional organizations is essential. We probably need to create 5 to 10 centers for chaplaincy research around the country. So there are a few of them that are emerging. Mount Sinai, the Center for Spirituality and Health, is one of them. IU Health, the Evans Center, is another. Transforming Chaplaincy at Rush has the potential to be another. Cincinnati Children's Hospital Medical Center has potential to be another. But part of what is needed at the Centers for Research about Spiritual Care is actually endowments. We need to have endowed positions for chaplaincy researchers and the research programs that will continue year after year after year, not relying just on getting grants. That those researchers will have to get grants, but they need to actually have some basic level of endowment and support. And we need to do that in a half dozen or so places around the United States who can become the centers for spiritual care research. So it may be that some of you who are listening today could not think of anything more unpleasant than having to do research yourself. But you may have a gift and a skill for actually communicating the importance of chaplaincy research to others. And you may have the ability then to find donors who can help create the endowments for the research centers that we need. And that's an essential bit of work in lots of different places, in these centers and in our chaplaincy departments. So we will do what we can in transforming chaplaincy over the next 2 years. During the last 2 years of the Templeton-funded work, we're thinking of ways in which we can transition transforming chaplaincy from a kind of time-limited 4-year project to a kind of more enduring chaplaincy research think tank that we hope can serve the profession. But we need your prayers, we need your help in finding the donors for that. So we've done a lot of good work with chaplaincy research. We've really come a long way. The last 5 years, we've actually really stepped up and moved along in some very important ways. But the really hard work actually is now ahead of us, and we all need to take our part in doing that research together so that research can deliver on all those important things we've been talking about all day long. Thank you.
Now it's time for our question and answer session. So far we only have a few questions, so I'll ask them slowly. The first one is this. We have a team of over 100 chaplains